crazy. Some of your cranial nerves operate together flawlessly. And oculomotor and abducens, great example. Because as you look laterally with one eye, the other eye is moving medially. Now, can you move your two eyes both laterally using the abducens? What? Yeah. Simultaneously. You can. Why? What would that do? I can't even come close to doing it. Can you move them both medially?
Yeah.
You can. Another test they would do when you go in, having your eyes examined. They say, look right, look left, and then they would do this to see if your cranial nerves were working properly. Because you can. As you follow something coming towards you, you have to be able to focus on it with both eyes. There's never a situation where you have to focus on something to either side. As I say that, there's a great example of that in birds. Maybe you know the bird, the woodcock. It's a really cool bird. Woodcock has that's actually not far from it. But it's very cool because when you look at the head, the eyes are sitting at the apex on either side, and it has the ability, when its eyes are focusing out here, it has binocular vision in front of it and behind it simultaneously. So the vision from here does this, the vision from here does that. It's got all of this. It's outrageous. And there's no way you can sneak up on this bird. It's kind of interesting. So,
Flies, do you?
I'm sorry?
Flies?
No, flies are just weird. Flies are bizarre. They have very cool eyes. No, their eyes are sitting mostly on the front of their head. So, yeah. But they have the ability to swivel their heads really quickly. So what else can I tell you about the abducens? Not too much.
But what about people that have a lazy eye?
Strabismus. Okay. Lazy eye is when your eye kind of wanders, and it does mention that here. Internal strabismus. What happens with lazy eye, as they call it, is the lateral rectus tends to be too tight, so it pulls the eye out. So that when you relax, like normally right now, if you relax your eyes, if you're just in a relaxed situation, wherever you set your eyes, they'll stay. So if you're looking at me, you look at me and that's okay, you relax, everything is fine. With strabismus, when you look at something and relax, the eye tends to move. So it's gonna go. So that the lateral rectus is tighter than the medial rectus. Typically, you do exercises for that. You can have surgery, but you can do exercises, and the exercises are focusing back and forth on your thumb, exercising the medial rectus muscle. Just like any other exercise, it's to make that muscle stronger. So, yeah, so it's pretty straightforward. Here's a monster, number 7, the facial nerve. The trigeminal has 3 major branches. The facial nerve has 5 major branches. And that's just the major branches that are motor, because the facial nerve innervates the nasal cavity, innervates areas of the mouth, glands, the tongue. There's a lot going on. This is a very big, complex nerve. As far as musculature goes, we have the temporal branch, the zygomatic branch, the buccal branch, the mandibular branch, and the cervical branch. This all has to do with muscle, once again. So this is the motor. This pretty much motor. This is mostly sensory. So lacrimal glands, nasal glands, submandibular, sublingual in here, and the tongue. This is sensory, mostly parasympathetic though. So there's all sorts of things. So it's very complicated muscle. Very complicated nerve. I don't know why I want to call it a muscle. The figure in your textbook shows some of the complexities. We're gonna look at this again later. There's a lot involved here. The various branches coming out and where they go. That's number 7. Number 8, vestibulocochlear. What an incredible nerve. I mean, you know, the nerve itself bifurcates way before it targets, becoming the vestibular nerve and the cochlear nerve. The vestibular nerve innervate. I'd like to go to a drawing here. The vestibular nerve innervates the vestibular area of your middle ear. This is going to be highly associated with balance. The cochlear innervates the cochlea, which is going to be entirely associated with hearing. But what this should help you understand is almost all the time when you have a balance problem, you will simultaneously have some hearing issues. And when you have a hearing problem, you will have some balance issues. So let's take you to the amusement. Most of you been to an amusement park? Been on crazy, spinny, wild rides. And you come off the ride and you're having trouble walking straight, okay? So your balance is off a little bit. But what you may not have noticed was that your hearing was also a little funky. And you go, oh, it must be from everybody screaming. No, it's not. It's from the fact that you have seriously caused a lot of signaling to go on in here that also affects hearing when they become joined together as the vestibulocochlear nerve. So, anybody get seasick, car sick, plane sick, any sick, go sick? Yes. Do you take drugs? You should. Always take drugs if you have the option, you know? Oh, there's some great drugs out there.
I get really bad air. I refuse to go on airplanes.
Okay.
I get really air sick and they try giving me, what's it called? You can get over the counter, but
Oh, you don't want the over-the-counter stuff. You
Yeah,
want
but-
the prescribed stuff.
Yeah.
Benadryl is always a good one. Okay, Benadryl helps, yes. Better, you can get the patch.
I was gonna say, I don't like the pills, that's just so
Yeah.
The pills can upset you. Anytime you have to take a pill for something, if balance is involved in the first place, come on,
Yeah.
your stomach is getting wonky. How many of you have, you know that you've heard the patch? Put the patch on. So you go to your friendly doctor and say, I'm going to be flying, I'm going to be going on a worldwide cruise, I'm going to be doing something. For some noteworthy anniversary, I took my wife whale watching. This is really cool. I mean, you're in a little boat, you're out with the whales. Her only problem is she gets violently seasick. But it was going to be really cool. I said, don't worry, you're going to take drugs. And she goes, oh, I don't like taking Benadryl, I get dry mouth. I said, don't worry, you're going to take something better than that. We're going to get you the patch. So the patch is scopolamine. Scopolamine is a wonderful drug. It is spectacular, okay? And there's a reason it's spectacular. It's an opiate. Opiates are great. Opiates do wonders for you. You remember opiates? What do they do for you?
Being modulated.
They what?
They numb, being modulated.
They numb pain. They numb. And scopolamine is no different. Scopolamine kind of numbs the signals coming from the vestibular nerve, so that you can go out and do things that would make you seasick or car sick or motion sick. You don't have that. But when you get your prescription, it tells you, only put on one patch. Don't put on both patches. Your government has been using scopolamine for years. How does your government use scopolamine? They inject it into you. What happens when they inject it into you? You become disinhibited. You cannot lie. It's truth serum. At low doses, you don't get dizzy. At higher doses, you don't give a darn. So if you want to see the best, I have ever seen any TV show do somebody cranked up on scopolamine, there's an episode of NCIS, and I don't know, maybe you watch NCIS, maybe you don't. Anyway, where the terrorists have three of the guys, and they're one of the agents they're asking him all sorts of questions, and he's laughing, answering the questions. The guy hits him, he laughs, he answers. He's cranked up on scopolamine. You can't feel pain, therefore you can hit somebody, and you can't lie. That's called disinhibition. Okay? Your brain is terribly inhibited, and as a result, you're great liars. So, scopolamine, great drug. I don't know what else to tell you about that. So, we have all of these nerve fibers coming in here. In the vestibular area, we have these inferior fibers, superior fibers that are going to innervate the saccule and the utricle. We're going to talk a lot more about hearing, I don't know, right now. Sure, let's talk about this right now. We might not get through all the cranial nerves today, but yeah, Wednesday. Yeah. So, hearing. Signals come in through the auditory meatus, vibrate, tympanic membrane, signals come through the ear ossicles, coming through this, the oval window. So, hearing. What is hearing? What is it? Pressure?
Mechanical vibrations.
Mechanical, so what are we going to call those? No, they're not mechanical vibrations until they get here. Once they're coming in your ear as pressure waves. Is that a form of energy?
Yeah.
All right. So when you're hearing, energy keeps coming into your head. Oh my God, energy in, energy in, energy in. Sooner or later, your head's got to explode. You know, I mean, that's it. We have positive energy flow. Energy just comes in. Does your head explode? Yeah. I mean, we see it in movies every now and then, but it's all BS. Because you've got this window, the round window. The round window is a pressure release. Pressure coming in, pressure going out. But how many of you have noticed on occasion you have to swallow to relieve the pressure in your middle ear? Ever notice that? What happens when you do that? Your ears pop, but why? What's going on? You are utilizing, they don't show it here. You're utilizing this tube. There's a tube that comes down here. The tube is the eustachian tube, the auditory, the pharyngeal tympanic duct. It's got a million names. The eustachian tube is the classic name. And it allows you, we're going to get back to these couple little muscles here in just a minute. It allows you to equalize the pressure on both sides of your eardrum. The popping you hear is actually the pressure release when the pressure in here is equal to the pressure out there, so that your eardrum goes back to shape. You actually, when you hear some popping, you kind of hear the bones kind of clap together. It's kind of wild. You go